Perhaps some hospitals are not overwhelmed. Perhaps some counties are not experiencing this, even some states. Why were we applying a one-size-fit-all Band-Aid? My name's David Hesse. I'm a board-certified podiatrist, and this is my second opinion. One of my primary roles in my community is preventative care with diabetic foot care, which is immensely important. And I work closely with a wound clinic. And I see these patients at the early stage of preventative care, and unfortunately at the end stage, where oftentimes there's amputation and limb loss. And I've had patients that have missed their preventative appointments because their extended care facilities or their families have kind of refused to let them come out for their standard visits. So in some instances, I've seen them on the other end where then they show up a little bit late and amputation has occurred. During roughly the 8 to 10 weeks of my experience with the lockdown has been that my elective procedures have all been postponed or canceled. And the only urgent procedures that I'm doing are amputations, and that has unfortunately slightly increased in its rate. What we've been seeing in our community, which serves outlying communities that are more rural, is that, for example, the 5 hospitals that I operate at have all shut down elective procedures and moved to semi-urgent, urgent, and emergent only. The rural clinics that we traveling specialists go to were shut down indefinitely. We were not allowed to even see clinical patients that were willing to come in. And my clinical practice has decreased down to about 40% of my normal visit volume. Clearly somebody was taking these issues and making a political issue out of a healthcare issue. I wanted to draw it back to healthcare. And if people need to know that what the real answer is that perhaps some hospitals are not overwhelmed, perhaps some counties are not experiencing this, even some states. Why were we applying a one-size-fit-all Band-Aid, to the country and ignoring people trying to seek their normal health care? So it was kind of to reverse the whole political wave and bring it back to a medical wave and remind everybody that, for example, in my case, 60% of my patients aren't coming in because of the fear that they're hearing perhaps from Los Angeles or New York or Chicago. And so we needed to kind of get out and say, well, this is what's going on here, so why don't we treat ours a little bit differently?